For reaction on today's news, we're joined by Dr. Alex Wong. He's an infectious disease doctor in Regina. Thanks for your time today.
Thanks, Sam.
Before we get into today's measures, tell me what it's like in the hospitals in Saskatchewan right now.
Yeah, so Sam, I'm in Regina right now on service, like for infectious disease, and it's super busy, but the vast majority of people that I'm seeing are actually, people that don't have COVID. So it's a good reminder that, life is kind of continuing on, and we still have that huge number of people in the hospital right now that have issues and problems that have nothing to do with COVID. That being said, in central and northern Saskatchewan, so Lloydminster, North Battleford, Saskatoon, Prince Albert. I've heard from my colleagues. Again, it's like it was here in Regina back in March and April, kind of like a war zone mentality. Huge numbers of individuals, huge waits and emerge. Huge backups. So yeah, a lot of challenges. And a lot of nervousness, about whether or not we're going to be in a situation in the near future where we're going to be looking at ICU and medical triage.
Okay, so all that said, what is your initial reaction to the measures announced by the Premier today?
Honestly, it's a good start. We've been calling obviously for some substantive measures to help kind of get Delta under control here in the province. So, putting a mask mandate tomorrow in place and vaccine passport system, to help incentivize and move that group of hesitant individuals to action to get vaccinated, I think is a start. I think obviously the devil's in the details, so we need to find out a lot more in regards to exactly what it is that we're doing. I didn't necessarily hear anything about masking in schools. There's still a lot of questions around like our test, trace, isolate capacity, contact tracing, public health resources, and so forth. So there's a lot more to do, and I'm not actually 100% sure. I'm not super confident that this is going to be enough in and of itself to get us to a point where we're going to have to, where we're not going to have other measures, other restrictions that are going to be needed in order to try to again get all of this under control and avoid that triage situation that we're so worried about.
So I'm hearing you say that we might need more restrictions if things continue to get worse, but are the measures rather announced today enough to help with the burnout we're seeing in healthcare workers and the very stressed healthcare system? Will it help?
I think so. I'm really only speaking for myself here, but what I would say is that it's been challenging for me personally. I think for a lot of other healthcare workers to be calling for these, evidence-based scientific measures to be put in place, and then to have sort of week by week either nothing happen or no kind of announcements or press conferences. So the fact that we finally have some substantive action, I think, is a start. At the same time, for better or for worse, there's probably going to need to be more that's going to have to be done based on the modeling. We're going to double again in 2 weeks. And again, that could put us, to 80 to 100 ICU patients. So again, creating that additional capacity is going to be incredibly challenging, similar to Alberta. And so I think it's literally sort of like a day by day type thing. But honestly, at least for me personally, it's a step to know that the government's listening and trying to take some measures of substance to help manage this rather than just kind of letting it all sort of go unchecked.
We heard Alberta Premier Jason Kenney yesterday talk about how overwhelmed ICUs are in Alberta. How far away are we from being in that situation in Saskatchewan?
I'm only speculating, Sam, but honestly, I don't think it's really that far. Like, I think when you look at our curve relative to Alberta's curve, we're on that same super dangerous, steep upward trajectory where we're talking about doubling like in the next couple of weeks again. And these measures are going to take again like 7, 10, 14 days to start to have some impact. So practically speaking, probably a couple of weeks away, we're in a situation here where it's going to be a real challenge, mostly to find staff, like qualified staff, to look after all these critically ill patients, especially the nurses, respiratory therapists, the folks at the bedside who are really doing that day-to-day, minute-to-minute care. I mean, we just don't have that kind of capacity anymore, just based on the stress and the burnout that so many, frontline healthcare workers have faced. So again, it's a bit of a scary situation. I'm trying to sort of mix a degree of optimism with today's measures with a bit of guarded realism in the fact that we are still in really, really big trouble right now. So it's a start. We're going to have to monitor the situation closely, and I'm hopeful that the government will continue to put whatever measures need to be put in place to help safeguard our system.
Quickly, before I let you go, you've mentioned a few times maybe needing more measures. In your opinion, what would those measures look like?
Again, I think a lot of the comprehensive measures similar to kind of what Alberta put in place in terms of gathering restrictions, again, significant expansion of our public health test, trace, isolate capacity to help get things under control more quickly. Those are the types of things that can help make a significant impact quickly on our curve. Compared to something like a vaccine mandate or passport, where again, it's going to take time for people to get vaccinated, for people to be protected and so forth. That's something which is more of a long-term piece that has a lot of value, but it's not clear that it's going to make a huge difference over the next 2 to 4 weeks.
Thanks so much for your time and for your work, Dr. Wong.
Thank you, Sam.
Dr. Alex Wong is an infectious disease doctor in Regina.